During the COVID-19 pandemic, Smiles Dental Group continues to provide emergency dental services to patients that have severe dental pain and infections. Due to circumstances, some patients could not afford their urgent treatment. The patient in this video, John, is a new father and had lost his job when businesses were shut down in March. He had several teeth that had become infected. The infections had spread to the right side of his face and near his right eye. He had been to the hospital where doctors were unable to drain the infections. He had already been on several rounds of antibiotics and painkillers. The pain and swelling were keeping him up at night and making him sick. It was becoming unbearable for him. It was clear that John needed several extractions ASAP, but could not afford the treatment. Dr. Ye and the team at Smiles Dental Group decided to step in and help this patient. In return, John promised to pay it forward by making a donation to the Edmonton Food Bank. This is the patient's panoramic x-ray where you can see there are many problems in his mouth. However, we're going to be focusing on the upper right side where he's experiencing a severe infection and swelling in his upper right face, which is spreading to just below his eyes. His eyes are actually starting to close, likely due to the abscesses related to the upper right lateral incisor as well as upper right second premolar. He's also having severe pain in the upper right wisdom tooth as well as the second molar, and there is a supernumerary tooth in between those two teeth that we'll be extracting as well to help this patient out from his severe pain. Okay, so this is our simple surgical extraction setup here. We've got a couple forceps, luxators, curette, tissue forceps, etc. So the difficulty here is trying to get adequate anesthesia for the patient, which is why I'm doing nerve blocks. I'm doing the PSA as well as the infraorbital nerve block, as well as the palatal injections, as well as some of the filtrations. The first extraction is the upper right lateral incisor. Recall this was previously root canaled and it had failed. The patient had decided not to retreat that root canal just to get the tooth out, which I think under the circumstances was the best option. We're just curating any of the granular tissue as well as some infection, just suctioning that out. I did end up putting a little gel foam in there because it was bleeding quite a bit. We're just putting it in there for now. The next tooth that we're going to be extracting is the supernumerary tooth, 1-8A, I guess we'll call it. It's just a little guy with a little kick in the root. So we're luxating now. I'm just elevating and luxating the wisdom tooth, the upper right wisdom tooth number 1-8, and there it is. So it did have like a pretty angled root there, which is difficult to extract under normal circumstances, but we spent a lot of time luxating that tooth. So we're fortunate that we did not fracture the root tip. We also are using the same kind of techniques to remove the second molar. It's pretty much out of the socket. We're just using the forceps just to retrieve it. I don't typically put a lot of force on the with the forceps because I find that root fracture risk is higher when you do that. You can see the patient's under the patient's right eye. You can see that swelling in that shot there. So we're just refreezing a little bit, just giving him a little extra freezing. We're starting to feel a little pain there, and just to keep him comfortable while we extract the root tips here, the residual roots of the upper right second premolar, tooth number 1-5. There it is right there. You don't see it there, but quite a bit of pus was coming out of that socket. These are the 5 teeth we removed. It was a good shot of that curved root. So now I'm just going to get him to bite on some gauze to help the blood clot form, or the blood clots form. I only have 2 hands, so I need my assistant to place the other piece of gauze there, and then we get him to bite down as hard as he can. I always tell patients to keep that gauze in there for 30 to 60 minutes. In this case, I'll probably just tell them to keep it in there for a whole 60 minutes. I'm also, the four main things I like to tell patients is don't spit, don't rinse, don't drink through straw, and don't smoke for 24 hours. And that is to protect the blood clot so that he doesn't lose the blood clots prematurely and then put himself at risk of dry socket, which is sometimes worse. I hope this video was helpful. On behalf of the team at Smiles Dental Group, we hope that everyone is staying healthy and safe during these trying times. If you or anyone you know is experiencing a dental emergency, please call the number below or visit us at smilesdentalgroup.com.